There we go.
Okay,
Thanks,
cool.
Kelly. So we like to record our meetings just in case folks can't be here. We can post it to our website and they can get the information themselves. So, like I said, I'm Becky Huckabee. I will go ahead and let Kelly introduce herself as well.
Hey, everybody. Thanks for hopping on and joining us today. I'm Kelly Russell, and I'm the other JBBS program manager. So pleasure to have you all with us today. Thanks for hopping on.
Kelly, could you please introduce yourself?
What's that?
Athena, just asking Athena to
Athena.
introduce
I'm
yourself.
sorry. I thought you said Kelly. I was like, girl, I just went. Okay,
Sorry.
yeah. Athena.
That's what I heard was Kelly too. All right, I'm Athena Pappas. I process the invoices after Becky approves them, and I will be working on your renewal contracts and amendments starting soon.
Thanks, Athena. Stephen, could you provide just a real quick introduction for me, and then we'll do a larger introduction for you and your team here in a bit.
Yeah, Stephen Wells, BHA. I'm the Crisis Services Program Manager.
Awesome, thanks, Stephen. And Carrie, looks like you're on here as well. Could you just do a quick, brief, who are you introduction?
Sure, I'm Carrie Bolter. I'm the Associate Director for Crisis Services at BHA.
Awesome, thank you, Carrie. And do we have anyone else on BHA? I was trying to search participants, but I didn't see anybody else. Okay. All right, we'll go ahead and move on a little bit. So quick updates. So you probably don't have your JBBS budget yet. We're getting down to the wire, but we've had a couple conversations with counties and we're working on those budgets. We're working with Joe, which you probably all have met in other meetings, as well as our fiscal team to figure out budgets. Those should be coming. And once budgets come, Athena can plug those budgets into the contract and get those contract renewals, those amendments out to you, for next fiscal year. So that's coming, but we're working on some things on our end. If there are questions, if there are concerns about that, please go ahead and shoot Kelly or myself a direct email, or both of us, or the JBBS email, whichever you prefer, and we can answer those questions and concerns. Also, if you have a meeting scheduled, we can answer any questions or concerns during those meetings, and we can go that route. Any quick questions we would like to address at this point about budgeting and contracts for fiscal year 25? All right, cool. So we will go ahead and get started with our crisis discussion. So thank you, Stephen and Carrie, for introducing yourselves. We invited Stephen and Carrie here. As we all know, this year, mobile crisis can no longer respond to the jails, as we all know. And there's been a lot of discussion in our individual county meetings saying, hey, what can JBBS do for crisis? What can JBBS not do for crisis? At this point, we do not have the budget to manage crisis at the JBBS level, which is what we've talked with you all about and what we've talked with Carrie and Stephen about. But we wanted to get feedback from you. Carrie and Stephen want to hear what you all are doing, any problems, any possible solutions, and we can take that back to our leadership team. So Carrie, Stephen, I'll go ahead and leave the floor open for you both as well.
Thank you. It's really important to hear not only how jails have made this work with mobile crisis not being able to respond, but how it is impacting those jails who have not been able to find a replacement for this, so that we, again, as Becky was saying, is that we can speak to our leadership about this and determine where funding could potentially come from to enhance those services for you.
Yeah, and I would just echo Carrie in that it's an important issue for us. We just kind of got brought in. We didn't realize this was an issue till recently because both of us are pretty new. So we're trying to be nimble and make sure that the jails are served, even though mobile crisis can't go there anymore. So yeah, very curious to hear if there's anyone who's gotten any solutions, things that have worked, and how we might be able to support that.
So with that said, Carrie, thank you, Stephen. We're going to open up the floor. We need you all to provide feedback. We need you all to talk with Carrie, and talk with Stephen about what you're seeing, what successes you're seeing, what issues you're seeing, all that good stuff. And if we need to call on people, there are also, let's see, 57 people on this call that we can possibly call on, and we know all of you. So nobody's safe, even if you're off camera. As I see multiple people drop off. No, I'm just kidding. So please, floor is yours. We want to hear from you. Carrie and Stephen want to hear from you.
Hi, I'm Kara Campbell, and I can start the conversation for Clear Creek County. I think all of our staff are on this call because this is something that we have faced for years. Clear Creek is a smaller jail, and they don't have any mental health supports in the jail aside from JBBS. So they come to us for absolutely everything that's related to mental health. We were starting to think about the new dynamic of there are clients who are pre-contemplative, they are maybe in holding, they're not sure if they want to join services. And so in our minds, it's like, well, if we are working with people at any stage when they are inmates, it is preemptively getting them prepped and ready to be in the JBBS program. Maybe there might be folks who are in holding who obviously could use some mental health treatment, but it's been bad in the future, in the past. And we don't want to talk to you, but developing those relationships while they're getting out, helping them kind of stabilize, getting them into the program so that they can work and be better prepared to be released. So we get pulled in every direction, and are constantly trying to like maintain like where we are. But yeah, we're there. We want to help everybody. So it's hard for us to understand where that line is of, yes, we can do this. No, we can't do that. It's a question we've just been asking really for years of where does the jail, like, do they need to hire their own? But we haven't almost enough FTE to maintain all levels of care with our funding. So we've talked about different grants. Just hearing this now is a little disappointing because there was a grant they were going to apply to get more FTE, and I'm not sure if it's lapsed or not. This is just me blathering. Does anyone else from Clear Creek want to add to what I was saying? It's complicated.
Yeah, I can say a little bit. We just kind of need direction, I guess, more than anything. We want to make sure that we're not doing anything that could jeopardize the JBBS grant that we have, since we are the only mental health provider. We want to make sure that we're serving as many folks as we possibly can, just kind of like what Kara said. But at the same time, we don't want to do anything that's like too external of our scope and then risk, losing our grant because we're serving folks that don't necessarily fall underneath the contract. So it's kind of like fear-based a little bit, and why we're apprehensive to provide crisis services. But at the same time, we are, again, the only mental health provider. So, and it puts a strain on relationships within the jail between jail staff and our mental health staff, and also creates confusion because sometimes we can provide services, sometimes we can't, and it kind of goes back and forth. It's like very case by case. But that's where we're at right now.
If I could kind of just jump in there with one more comment, and this is for Carrie and Stephen. So when there's JBBS clinicians in the jail, I think it's kind of more or less assumed that they can handle or should handle all crisis situations. That's really not the case, or that's not the intent of JBBS. And so I know for Clear Creek, that's a problem that we've kind of been running into, is that the JBBS clinicians' roles are kind of being a little skewed, looked at differently by the jail staff, as far as, well, you're here, so why can't you just help this guy out? Which that's not really the intention of what this program is doing. So, and Kara and Mariah, I don't mean to, if I'm not saying all that incorrectly, please correct me, but that's kind of what I gathered from our discussions that we've had about this before. Yeah,
you got it.
So we're just always being pulled in to do things that is out of the scope, but then it's like yeah, what Mariah said, do we want to negatively impact our relationships with the jail? Do we have a moment to help somebody, but then just say no because we're bound by this? It's like a really like an ethical dilemma that we experience, and we try to help where we can, but want to be said true to our contract. Clear Creek does have a part-time crisis clinician who's local, who can come into the jail. Her role is different than oh no, Carrie can't come anymore, can she? That's right. Yeah, no, we don't have any help in Clear Creek for that.
I'd like to just jump in here as one of the clinicians for Clear Creek. It does make it very difficult for relationships with the deputies, including all the way up to our judge. I have actually had our judge call me before and ask why I am not seeing someone in holding. And that is a really difficult conversation to have as a clinician, and try to explain to her that that's out of our scope and something that we're not allowed to do. And then she asks, well, then who do we need to call to get help? And right now it feels like we don't really have an answer. And I think that's where we also struggle a bit.
So can, just for the sake of everybody, okay, so let's say somebody gets booked into the jail and they're in crisis. Can you kind of just walk us through what happens as it stands right at this moment? Or not?
Yeah. Yeah. No, yeah. As of right now, most folks, if it's within JBBS hours, there's a clinician on duty, like 8 to 6. Then jail staff typically call myself or Kara and let us know that someone needs to be staffed or someone needs to be seen. And so we'll have Brandy or Hannah, our clinicians, meet with them and do a Columbia as well as a safety plan if necessary. And then we let jail staff know whether or not they need to remain in holding or if they can be moved to general population. So we're providing those crisis services out of necessity, not necessarily anything else. And then we reassess within 72 hours after, just based on staffing, and then as time allows. We don't really have much of a choice otherwise.
And those interactions really do, I think, are important because it starts building rapport with clients at that point. And so even if they're not ready to engage in JBBS, that relationship is being built and prepping them to be able to sustain, I think, through treatment and then even like after release.
Cool. Thank you for putting that in there. And then I'm not sure if you guys saw April's question or comment in the chat. Kara's spot on with about how in small facilities, JBBS mental health is really leaned on for crisis. To work with these pressures, we actually applied for JAG funding to see if we can uplift a few cells to make them padded cells and increase our number of suicide watch doors to provide more safe spaces. So yeah, they're kind of in the same boat. And I would venture to guess that Garfield and Clear Creek are probably not the only ones experiencing these types of problems.
I was just going to say that Gunnison is also a very small jail, and also JBBS is the only mental health that provides to the jail. And so if an inmate is in crisis of any kind and I'm not here, the jail has no other choice but to take the inmate by ambulance to the hospital to be assessed at the hospital, which is a huge cost to the county.
Thank you, Marilyn. Did anyone else want to comment on this? I'm curious what some of the other jails are doing.
Yeah, I will, Kelly. Travis Belden with Kit Carson County.
Thanks, Sharon.
So we also have a small jail, and we do have a local resource, Centennial Mental Health, but I do not use them very much for the jail. Instead, what we do, so we use Southern Health Partners for our medical and various other things. And within my contract with them, I have access to 24/7 mental health crisis should they need it. And that's all done via telehealth. I mean, they provided the kiosk, the whole 9 yards. If somebody really needs it, we roll it in, they do their thing. And that has seemed to work really well. Aside from that, they do hold mental health meetings once a week, generally on Thursdays for, whoever wants to participate. That has seemed to be highly successful and keeps people from going into crisis, so to speak, just knowing that they get to meet with somebody, weekly. If we do have somebody that, attempts suicide in the jail or something like that, obviously they get locked down. And so that's when we do use Centennial, is for that clearance before we let them out back into a general population pod again. I don't know if we're going to keep doing that, because I'm being told as of the other day that Centennial Mental Health has decided they're now going to start charging for that. They have not called and had that conversation with me. I've just got that through the grapevine, so I don't know what that'll look like. They're picking a really bad time of year to do that. They should have probably approached sheriffs about this last year when we were doing our budgets, but they decided spring of this year would be a better time to do it, a quarter of the way through our budget. So I don't know what that'll look like going forward, but the telehealth thing with the mental health crisis through Southern Health Partners has really seemed to work well.
We did use that a little bit in the past too, and we're getting the same sort of pushback as like crisis isn't necessarily here to fulfill a jail's need for crisis services ongoing. So they're really like, you can utilize this if it's really needed or if it's after hours, but they're like, we can't be the go-to to help every crisis in the jail. It's just would be too much.
Well, and we've had a lot of luck too. So, I mean, for the majority, most of our mental health people are local. I would say at least 85% of them are local people that are already going with Centennial anyway. And so even if they're not using Centennial and they're using, the Southern Health Partners deal, we've had really good luck with them communicating with Centennial if they feel like they need something, need to adjust meds, whatever, setting up appointment for them to meet once they get out of jail, whatever it is. So all in all, that seems to be working really well. Knock on wood that it stays going like that.
Real
Cool.
quick, everybody, Carrie has her hand raised. Carrie, if you'd like to step in real fast.
Yeah, you know what would be helpful for me as well is to really understand what need crisis fulfilled for the jails. For example, I just heard one is coming in and releasing kind of that suicide watch, saying that this individual is no longer imminent risk, can come off a suicide watch. But what other ways were the jails using mobile crisis? So that will help me with an understanding of what the needs are.
Release back to community is one. A lot of folks, a lot of times they want to know if they can release them from custody. Is from us, and we've since set that boundary that we're not going to do that. That's ultimately up to jail admin and jail staff. But that's one other example that I can think of right now.
So are you saying that they would want the crisis provider to conduct like a mental health hold screen, a screen to see? Okay, so, and is the jail reluctant to have the security staff, because they are law enforcement, place that mental health hold themselves if that person is suicidal?
Mm-hmm.
Okay.
Yes.
So part of the problem with that is that if they're in our custody, we can't M1 them. So if they're in our jail, we cannot M1 them.
On their discharge,
They would have to be completely discharged from the jail, let out of the facility, and then we could place an M1 on them. But while they're in our facility, we cannot place that M1.
That is what we do. It's like the judge will say, okay, this person can be released, but if the person is in holding,
Right.
then it's like they're like, we can either release them to the community or we can release them to like M1.
Right.
And so they are wanting us to like stand in and us or the crisis team to stand in and say
Well,
which route to go.
I don't think that necessarily should, I guess from where I sit, that shouldn't fall on the crisis team. I mean, once they're given a PR bond or whatever, we have no choice. We have to let them out of our facility. And so I guess if you care about your community as a sheriff or jail captain or whatever, you'll do whatever has to be done once they're released. And I would think that placing them on the M1 would be the way to go. That's how we do it. I'll let them out. My guys will grab them outside. We M1 them, take them to the hospital, and we get them screened. So
At Archuleta County, we've had to do the exact same thing several times.
Thanks.
It's nice to hear we're like not alone, you know, like there's we're doing some things the same. That's good to know.
Anybody else? Maybe some other parts of the state. Anybody else want to speak up, or any of our metro area jails?
Go ahead, Lawrence.
Yeah, so up until very recently, we've just been using Mind Springs, which is the community mental health in Northwest Colorado, to come in and do the assessment. So when we would call them, they would have the on-call crisis clinician come in. They would complete the screen to see what level of care this person needs. You know, do they need a safety plan? Do they need M1 hold, stabilization with medications, stuff like that, just the normal crisis response. And then our judges have been very good at working with us. They'll come out, kind of release them on a retainer. If they meet M1 criteria, they will, I mean, we set up transport, take them to West Springs or whatever bed space is available, whatever facility. They get the care they need, and then West Springs or whoever just make sure that we know when they are stabilized and about to be discharged, and then we just bring them back to jail. So that's how it's worked in the past, but very recently, kind of they were doing that out of the kindness of their heart, so to speak, to retain good relations in the community, but that has come to a stop. And we are basically going back and forth between should we just create a fee for service type contract with them to continue, you know, how we have been doing things. The local hospital ER is also setting up their own crisis response program that they will have in-house. So that's another kind of contract that we could potentially be looking at shortly, or you know, finding a telehealth service. So it has worked amazingly. I feel very lucky to, I mean, I used to work for Mind Springs, so I have working relationships with all the people there. And so that has been very seamless. Mind Springs does not have the greatest reputation in all counties, but in Moffat County, we've been able to have a good working relationship with them. And so the fact that this whole I don't know if it's legislation or more just how Medicaid is working with them, or telling them what they can and can't do for mobile crisis response, but it's creating lots of problems. And so, yeah, we're kind of just recently in the same boat as what Clear Creek has been saying and others as well. So, but from what the sheriff says, there is legislation coming through that is most likely going to be passed that is going to prohibit law enforcement from bringing people into the jail that are in crisis. So they would have to get their mental health needs met before coming to the jail if that is the case. So that is hopefully going to pass, keeping my fingers crossed, and that will help out tremendously. So that's what I got.
Thank you, Torrance. Anybody else? I'm curious to hear from as many of you as we can, and I know that Carrie and Stephen will be as well. This is definitely an open forum to share your concerns, which there are many of.
I just put a comment in the chat, but figured I would share it out loud with the group too. But I think it was April had said that, it's the crisis assessments can be a great way to get people engaged and learn about the program and maybe ultimately join the program. But another thing we've run into is many of the folks we're being asked to provide the crisis services for don't meet eligibility requirements to join our program. So then it feels like we're in another ethical dilemma by providing the crisis services, because we know there's clearly a need, but we're not able to meet that need.
Thank you, Hannah. Anybody in the South area, Southeast, Southwest area, do any of you all want to speak up and kind of explain what's going on in your areas? Rick or Jill, Laura, any of you all?
I can speak to what many of our jails do. La Plata County and San Miguel and Montezuma, that they contract with Access Health System to provide crisis services. It's they have a process for being able to through the nursing staff. It'll be deemed, yes, we'll call a crisis team in. Sometimes JBBS does go in to see if maybe they could stabilize the situation and see what's going on and see if crisis needs to be called. And then we work really well with the crisis team. Being an access program, we're able to then coordinate care, aftercare once whatever has happened with this person, either if they've been cleared or if as discussed before, where they had to be placed at a higher level of care, where they were taken to the hospital, then PR'd, then taken to the hospital to have an assessment completed. So, yeah.
With Pueblo County, we are fortunate. We have a mental health department there that handles all the crisis, handles all the mental health. We work very closely with the mental health department and our JBBS clients though.
Okay, thank you, Jill. Thank you, Rick. Anybody else?
Yeah, that's the same for Douglas County. We have a mental health, the jail has a mental health separate vendor. They deal with all the crisis. If JBBS comes across anyone in crisis, we can refer directly to them. So yeah, we're lucky.
I feel that yeah, go ahead. Okay, maybe Yvonne, I wasn't sure if you were talking to us. Yeah, go ahead.
Yes. Here in Fremont County, I find that is definitely a struggle as far as mental health goes. We do have a mental health provider who is here from one of our local facilities. As far as any kind of intervention in the moment, if somebody is going any kind of mental health or any mental health issues, the effort by the provider we have is not immediate. She put it in, all she usually will respond in the next couple of days. So it is definitely a very large issue that Fremont County needs to hopefully find a way to fix that. I do know that commissioners have used jail and to try and increase the mental health contracts or to reach out to other providers to get into the jail.
Okay, thank you, Yvonne. Appreciate your comments as well. Anybody else? And thank you also to those of you who've been writing in the chat as well. We'll have we'll make sure we have all that as well. So yeah, lot of side conversations going on, a lot of discussion going on about this. It's clearly a bigger issue than, I mean, it's a huge issue, obviously. One thing that with our larger jails and you know, especially the ones who do have a medical vendor, a contract with a WellPath or a Vital Core or a NAFCare or a Turnkey, it does look different for a lot of those folks because usually there is a contracted mental health provider. And Carrie and Stephen, this is more for you, and I'm sure you know a lot of this already, but it's really a lot of these smaller jails and more frontier rural jails, or the ones who don't have, you know, 24/7 medical / mental health coverage, that really tend to struggle with these types of situations, as you've been hearing from everybody. So anybody else have anything they would like to add to the discussion? Or Stephen or Carrie or anybody else have questions for anybody here?
I did want to just ask, it does seem like there's a few jails that are contracting with local providers. We realize that's probably not going to work in every county, especially for smaller jails. But wondering where you're getting that funding from. Is it being paid for out of the JBBS contract, or is it being paid for by other county funds? If just a little bit of insight on that would be great.
Anyone want to speak to that? I'm assuming it's county money.
That's what I assumed, yeah. But I just want to make sure.
Yeah. Thanks, Alma. Yeah. If it's not county funds, maybe somebody could, if you don't use county funds for that, let us know. But I'm assuming that's the case for the majority. Unless anybody's out there writing checks out of their personal bank accounts for this.
Hey, you never know.
If you are, kudos to you. Way to be a team player. But I'm going to guess that's not the case for the majority. So
I can jump in for Eagle County.
Thank you, Sarah.
Well, we've kind of had a change over the last few months, but before the end of the year, we were working with Your Hope Center, which is a community crisis organization. And those were that was being funded by marijuana tax money. So that is an all county organization. Unfortunately, at the end of the year, their insurance company said they would no longer cover them if they worked for the jail. So we lost that at the end of the year, but yeah, so that was coming out of marijuana tax funds. Now we are contracting with correctional psychology associates out of the Front Range doing telehealth. They've been amazing and been able to help us jump in at the last minute, but I don't know how sustainable that's going to be for us because now we're searching for those funds. A lot more grants that I'll need to look up and different things. But yeah, that's our situation up here. I'm also hearing a lot of, I feel like we're in the same situation again, like with Clear Creek, that yeah, our deputies don't want to be the ones to make that call, that mental health call of do we M1 someone or take them off of our crisis protocol because they just don't feel comfortable. And our contracted services are now for 20 hours a week, not 24/7. So it does kind of fall back to staff to, okay, where do we fill in the gaps in the middle of the night when someone pays their bond or PR, and then we must let them go. So that's our situation.
So here in Prowers County, I guess it's not a black and white situation. whenever we have crisis calls, first of all, we try really hard to have all of our jail staff CIT certified. So that gives them some tools to determine whether or not it is indeed a crisis. They don't always make the call. We have a nurse practitioner that is on call 24/7 that helps them to determine whether or not they need that crisis help now. And then we work with a private provider that does telehealth. So we have a tablet that she will do the assessment on. But as far as the billing, thankfully, we are invoiced for those things after the fact. So if the mental health or the crisis call was made due to substance use or alcohol, those types of things, and they eventually end up in the JBBS program, we do bill that to JBBS. If they are not, then we pay that out of county funds. So there's a few different criteria that they have to meet to determine whether or not we use JBBS funding or our own private funding.
Thank you, Marcia. Anybody else? This is your chance to.
Torrance, did you have something else that you like to add?
Yeah, I keep hearing people talking about basically, you know, if there's someone that might be in crisis, when they get out. I don't know if everybody's familiar. I hope they are familiar, but there is what's called an M.5, which is mandatory transportation for assessment. So even if you don't have the staff that want to make the call, they can fill out this form and basically, even against someone's will, transport them to a facility to be assessed by a mental health professional. Because in my book, you know, doing due diligence, letting someone out of jail with no assessment whatsoever, and having the knowledge that they might be in crisis, that would be an unethical thing to do. So there is an M.5, which is just transportation to be evaluated. Then once they're at the facility, they are the property / responsibility of the facility to get them evaluated.
Thank you, Torrance. Thanks for mentioning that too about the M.5. That's from when I was at Jeffco, that was a rather underutilized situation, but I think it's because we didn't necessarily need to have it as much as I'm sure other places do. So, but that is something that is out there. So thank you for bringing that up. Anybody else have anything they'd like to add or have concerns or questions about? Again, we're taking all of this and kind of bringing it back to the folks on our end, and we have a lot to discuss internally, obviously. So, well, I don't want to, we can give you a little bit of time back in your day if nobody has anything else. We just appreciate everybody's presence and attendance today, because it is important for those of us at the state level to hear about the situations that you're having in your facilities. And a lot of you are just, we were kind of commenting, you're just in a make it work situation. And that's definitely not ideal, but it's necessary given the resources or lack thereof that are available to you. So just know that we are appreciative. And again, you know, we always say, like, you all are the boots on the ground that are spinning your wheels every day, trying to get these folks taken care of the best way that you know how. And so we are grateful for that. If anybody has anything that maybe we hang up and you think of something that you want to add to the discussion, please just email me or Becky or both of us, and we'll make sure that we bring that to our discussions internally as well. If anybody, I don't know, Becky, if you had anything else, or anyone, if not, we can probably end a little bit early.
Yeah, I was just going to reiterate that if anybody thinks of anything, please send us an email. As always, Kelly or myself or both of us or the JBBS email, wherever you feel comfortable emailing. I know Carrie and Stephen are also open to contact, and this is something I know it's frustrating when you air all of this and there are no solutions. But in order to get to possible solutions, we have to have all the information. So if you go back and you talk to some folks and some more information comes up, or this recording starts getting out and we get more and more, please let us know. Let us know what's going on in your communities. BHA can't help if we don't hear from you all. So we really appreciate all of the information, all of your feedback. Looks like Stephen has put his information in the chat as well. If you'd like to reach out directly, as always, feel free to CC Kelly and myself. Yeah, but other than that, if nobody has any other feedback, I'm okay ending early. You, Carrie, look like Carrie put her information in the chat as well.
Becky, Kelly, if you guys would hang on, and for just a moment, I'd like to talk to you about something else other than this topic you guys had, so.
Sure, no problem.
Thank you.
Thank you, everybody. I guess you are free to go. I guess you're free to go regardless, but thank you, everybody. Appreciate your time, and we will see you next month.
Thank you.